Hey, we're back, and I'm your host, BKP, and we're at Sycamore Crossing in downtown Blue Ridge, and it's now time for Ask the Doc with Dr. William Whaley, and we want to thank Georgia Cancer Specialist, North Georgia Cancer Specialist, affiliated with Northside Hospital for this segment. Dr. Whaley, how are you today?
I'm great. Yourself?
Okay, tell me how much you enjoy this cool mountain morning.
And ain't it wonderful?
I'm telling you what.
Hummingbirds 12 feet from the end of my bed. It's great.
Such a and I think it's the setting for what we're going to have, a beautiful 3-day weekend.
I like
here.
you with the white shirt too, because
it's my last
you
weekend.
got to take your you can still wear white. You just can't wear white shoes. Is the deal?
Is that the deal?
It's It's always white.
Oh, is that the rule? I don't know the rule.
White shoes. No, he was talking about
once it gets outside of the world of politics, I pretty much don't know what happens.
He don't know from nothing. All right, well, listen. We
all right,
questions today.
We have yes, we do. Yes, we do. We have a time schedule. Dr. Whaley, we do.
Picture, please, Amanda.
We do have a big question here that we want to make sure the doctor has plenty of time. I am 32, and I recently just started adjunctive chemo. Is that what I got?
Yes.
Okay, chemo for stage 3 breast cancer. If I beat this cancer, what is the life expectancy for me after chemo?
All right, that question uncovers so many different things that I want to box it out into several things. First, this patient's 32 years old, so the patient's too young to have been having regular mammography. And if she has, you got the chart up there? If you look at that chart, the whole top 3 images are early stage breast cancer, stage 0, 1, and 2, which you would be able to find if you were routinely doing your mammograms. The bottom 2, there are 2 different ones that are stage 3 there, stage 3A and stage 3B and C. Now this is very important. Stage 3 is relatively advanced cancer in a 32-year-old. So for the majority of the people that we're talking to, I'd like to just take that 32-year-old and turn her right back around. Let's make it a regular person that's over the age of 45 or 50. First lesson, if you're doing mammography, if you're doing breast self-examination, you will not be diagnosed with stage 3. So if you look at that stage 3, this is all the way out here in lymph nodes under the armpit or the tumors this big around. So if you're doing your mammogram and you're getting your breasts checked, you're not going to be at stage 3. I'll go back to the 32-year-old. This has to have been rapidly progressive. It's probably going to be triple negative, which means that estrogen, progesterones, and this genetic mutation are not there. If you will take that off next, please, Amanda, and put the chart up. I'll show it here to BKP. If you look at this chart up, okay, if you look at this chart, the top 3 lines, which go all the way to the right just about, which is 100% survival, are the stages 1 and stage 2 that I mentioned you're going to find if you're doing breast self-examination and mammography. When you go to the bottom, the next 3 are all stage 3, stage 3A, stage 3B, and stage 3C. They have different 5-year survivals and different cure rates. So let's now just take that off the board and let's get that chart up there, and it's going to stay there for a while. You ready? Here, all of the stuff that I've been telling you for the last, 18 months or 2 years about cancer, is that the advances that have been made in cancer are not more surgery, more radiation, or more chemotherapy. They are genetic drivers and monoclonal antibodies and things that are all related to genetics and what makes cancers start. So because this chart there are the things that make that stage 3 cancer have 3 separate survival rates. One is, how many of these lymph nodes are actually positive for cancer? Second is, how big is the tumor? To be stage 3A, that tumor could be 5 centimeters, which is 2.5 inches, or it could have a bunch of lymph nodes. But even that's not near as important is how rapidly is it growing, which is the histologic grade down there toward the bottom. whether or not under the microscope you can see the tumor invading the lymph channels or the arterial channels, whether or not it's estrogen receptor sensitive or not, or whether or not it has that antibody I've talked about all the time called the HER2/neu antibody. Now, all of those prognostic features, estrogen, lack of it, HER2/neu, positivity of it, if those things present 10 years ago were all adverse prognostic indicators, but now we have an antibody that attacks that genetic thing, the HER2. I've mentioned it before. So the HER2 expression now becomes a good feature because we can attack it with an antibody. I'm going to go back now to our 32-year-old. This cancer has to be, by its biologic behavior, in a 32-year-old triple negative, meaning the estrogens aren't going to help it, progesterone agents aren't going to help it, and the antibody won't help it. That used to be a death sentence. Actually, today, aggressive, that says I'm taking adjuvant chemotherapy for stage 3 breast cancer. I haven't seen that done in the last 10 years. A person who has that much cancer at diagnosis will be given what's called neoadjuvant chemotherapy, and that is before they have an operation. I've given the examples before that if you think about cancer, you got a pond, somebody's got a fishing pond in their front yard. You take a pebble and you drop it in that pond and the ripples slowly ripple from the center. Well, that's stage 1 cancer. You got mammograms, the ripples are right around the pebble. Stage 2, they're a little outside the pebble. Stage 3, they're way out there. So when it's right around the pebble, you go straight to surgery, you get a lumpectomy. But when they're way out there, we have to bring those pebbles back, those ripples back toward the pebble to be able to do good surgery on it. So this triple negative breast cancer in a 32-year-old, given the most modern and aggressive chemotherapy, I've got one going to surgery today, actually, down in Canton. When they do that surgery, we are all praying that there is no cancer in the breast, meaning that the original cancer and all lymph nodes are dead. If that is true, and the patient gets radiation therapy instead of a 95% recurrence rate, which was historical, you got a cure rate of 75 or 80%. So what I wanted to say to that 32-year-old is let's get into an aggressive program, and you've got a good survival rate if you're aggressively and appropriately treated. And the fact that that stage 3 cancer of the breast has got all those different survivals across that graph there tells you that the most important thing if you've got cancer is you've got to get into the hands of multimodality. That's really a huge word. You like multimodality? What does that mean? That's a multimodal sound we got back there. The train whistle. Transportation's multimodality. You got trucks, you got trains, you got airplanes. So that's good, right? Multimodality means before this woman started treatment, she should have had a conference of a medical oncologist like me, a surgical oncologist like Dr. Langella down there in Jasper, and a radiation oncologist and a genetic oncologist. Well, you can't do that outside of a cancer center. So if she's getting really aggressive therapy, I think she has a good survival, and it's just telling us, because she's 32, we've got to go to most of our audience out there who's not 32. Go get your mammogram, do your breast self-examination, and if you've got cancer, get yourself in the hands of a cancer center, and your outlook will be as good as it can be. Is that enough?
Yeah, but let me ask you something that I've noticed throughout the weeks. It seemed to be very helpful to you to know that the individual sending us this question is 32.
Correct.
Okay, and what I've noticed throughout the week, folks, you could send Dr. Whaley a question. You could send it to info, I-N-F-O, at fetchyournews.com. Put in the subject, ask the doc. But when you ask a question related to something like this or whatever, it's important sometimes to put an age in there, because so many questions we've addressed here, you'll say, I don't know how old the individual is.
That's right. You're right.
Right.
And this is well written.
Actually, that's exactly right. The reason I looked at that and I said, "Hey, I could tell by knowing 32 it was able to
make a big difference.
So when you send a question, but you're welcome to send a question, ask the doc, INFO, Fetch Your News, info at Fetch Your News, ask the doc, send it to us. And also we thank North Georgia Cancer Specialist, Northside, affiliated with Northside Hospital for the segment. Dr. Whaley, we've got a quick couple minutes here, but I do want to get to the second question. And maybe you have a brief answer on this.
It won't be that brief, but go ahead. You remember, if you ask me what time it is, I'm going to tell you how to build a watch.
Yeah.
Okay, all right. Okay, all right, already.
That's right.
I'd say nice words like brief.
That's right. We got, you're...
I don't say cut it off right here.
You're on my meter now.
Okay.
All right.
All right, don't make me laugh that hard right now. I am very concerned that my 12-year-old refuses to drink water or eat any fruit, vegetables, or healthy, nutritious food. Would you recommend referring him to a hypnotherapist? Now, I'm glad I'm not answering the question. I'm going to leave it to you.
Okay. Well, the answer to the question is clearly no. First of all, there is a great deal of misinformation or misunderstanding about what hypnosis can do.
Okay.
Interestingly, when I went to medical school, I was on a research fellowship in obstetrics, and my sponsor was the president of the American Academy of Medical Hypnosis, Dr. Fred Zuspan. And he was utilizing medical hypnosis to help women go through the pain of labor and delivery. But it went on then, think about this really carefully, it went on to teach people how to do auto-hypnosis. I'll just give you one brief answer, analysis. To make a skin graft to cover a big wound in the neck, like they do today for military people, they can move the skin and make it take root. But in those days they couldn't, so they had to create a pedicle of skin. They'd take a skin off your abdomen, hook it to the arteries and veins in your arm, and then sew your arm to your head and neck like that, and it had to stay there for 2 months. Well, going around like that for 2 months is tough, so that's why we taught people how to hypnotize themselves to where this discomfort could be fixed. If you look at the chart, is the chart up? True hypnosis cannot make you do something that you do not ordinarily want to do or would not ordinarily do. So if you do not have the capacity in you to rob a bank or commit a murder or whatever, hypnosis will not make you do it. Hypnotherapy has its place in just a few areas, and one of them's not getting a kid to eat vegetables. People who have phobias and fears, I'm afraid of snakes, I don't particularly like bugs, my wife over there, hypnosis might help. Hypnosis can help people who have a sleep disorder, just like this guy who has to go around with that thing sewed to his neck. It can help people with post-traumatic stress disorder and anxiety. It can help people with grief and help people with loss. It can help people with depression. It can help people with stress. But those hypnotherapists, all of them have to be certified professionals in treating those diseases. So the idea that you can come over here to the palm reader or something and hypnotize a 12-year-old to do what you want to tells me you got several better choices. One, take away their cell phone until they finished eating dinner and serve them what you want them to eat. Get the cell phone back after they've eaten what you want them to eat. This is a discipline problem and not a hypnotherapy problem. And I got hours.
Well, wait a minute. No. I mean, I'm thinking here and I'm trying to pay attention, but I came up with a great business plan. Folks, I can hypnotize your 12-year-old to do anything you want them to do. That's my new business.
It won't work.
Yeah, but I'm putting a sign out front.
Oh, yeah, well.
$29.99. Okay, anyhow. You said it. You said the thought of thinking you can hypnotize a 12-year-old. Dr. Whaley, final thought of the day.
All right, Zika update. Everybody stop. There have been 74 cases of Zika this year in the United States. 100% were brought back from travel in other areas, there have been no cases of Zika transmitted in the United States. So and 97% of those are Puerto Rico, which just had the hurricane, obviously has a lot of mosquitoes.
I know I got the All-Star.
So don't go to Puerto Rico, we're finished.
No, we're not. I got the All-Star panel, but this question I want to get in. You got a minute.
Yes.
FDA is now approving at record levels what used to take 4 years in record time. So many new generics are coming on the market. Things like that. Are those the things that are not making the news, that are positives that we're not hearing about?
Well, if I worked for a pharmaceutical company, I'd tell you it was terrible. As a physician, I'd tell you it's one of the greatest things in the world. We're catching up with the European Union and the rest of the world. We have had so many barriers and we have had so many regulations and it's so expensive to get something like this. Generic's going to be cheaper, right?
Yes.
So you don't have the $1 billion or the $400 million it takes to be able to get that drug to market if what you're trying to do is sell it cheaper. So yes, getting rid of these regulations is a very positive event.
I got to get the All-Star panel in, but one more thing on that note, because I think it's important, because it's stuff we're not hearing about that's getting underneath. Because I know of people that have gone to the doctor, they give them a prescription for something, they go over to the pharmacy and they hear the magic words, a couple things. One, it's not covered under your prescription. Two, it's $145. And three, there's no generic to go. And
EpiPens, we've been
but
talking
what
about
has happened to a lot of people, they'll go home.
They won't take the medicine. Actually, the statistic is that's about 35% of people.
Absolutely.
That's a huge number, 35%.
Thank you so much, Dr. Whalen. I appreciate it because I wanted to get that in. I'm your host, BKP. We're going to have an abbreviated all-star panel because our guest at 9 o'clock will be Speaker of the House, Georgia Speaker of the House, David Ralston will be with us, but we'll be back right after these messages. Thank you, North Georgia Cancer Specialist. Thank you, North Georgia Cancer Specialist.
Actually, Georgia Cancer Specialist affiliated with Northside Hospital.
Okay, thank you
we got 48
no, Amanda could tell me that. Amanda could tell me that. Thank you, Georgia Cancer Specialist affiliated with Northside Hospital. For this segment, we'll be back right after this.